We are in year one of the Federal No Surprises Act. The law that protects people from getting surprise medical bills went into effect in January, and we're just starting to see the effects of the new legislation. Surprise medical bills often come up in emergencies, when patients don't have the opportunity to choose their providers and end up receiving out-of-network care, or when patients go to an in-network facility for a scheduled procedure, but not every provider at the facility is in-network. This can definitely be confusing to patients, so here's an example. Let's say you go in for an emergency surgery or C-section. There are several doctors taking care of you, from anesthesiologists to radiologists, and after all is said and done, you come to find out one of them didn't accept your insurance, and then you're slapped with a huge bill ranging from hundreds to tens of thousands of dollars. But under the new law, everyone who takes care of you at an emergency room or urgent care center will be considered in-network care, and for scheduled care, you should be covered as long as the facility is in-network. The idea is that now you wouldn't be charged anything extra beyond what you normally pay under your current insurance plan. But there are still some gaps. While air ambulances are covered under the law, ground ambulance transportation is not. It's a little more complicated, and Congress may circle back to it. Studies show before this law took effect, 1 in 5 emergency room visits resulted in surprise medical bills. But the government estimates that this new act will apply to about 10 million surprise bills each year. And the law won't necessarily help those who already received surprise bills before the law took effect. Olympic cycling hopeful Phil Guyman knows the difficulty of getting surprise medical bills all too well. After suffering a life-threatening crash during the Olympic qualifying race, he spent time in the hospital, and even with 2 insurance plans, he was left with $150,000 of medical bills.
I was freaked out when it was $90,000 and the second bill came, and that might have been like the first time I cried in the entire accident.
This new law doesn't mean that surprise medical billing completely goes away, but it should help reduce the likelihood of this happening. But what about people who don't have insurance at all? This law doesn't offer protections for them, and according to a study from the Kaiser Family Foundation, they're more likely to report having significant medical debt. There's also another issue we've been seeing with medical billing: getting a bill for something that didn't happen to you. A new report from the Consumer Financial Protection Bureau found that last year, people's most common debt collection issues were with medical bills that they didn't actually owe. And this problem has only gotten worse in recent years. Between 2018 and 2021, the number of these complaints jumped by 31%. A lot of people don't discover this is an issue until they see a sudden dip in their credit score and are told that paying these bills will fix it. That credit hit can make it difficult for them to find housing or even get a job, all because of a bill for service they didn't even get. The new legislation has addressed parts of the issue, but medical debt is still a major financial burden for Americans. A 2020 survey suggests that Americans' collective medical debt totaled $195 billion in 2019. To talk about surprise medical billing and how we can address that problem here in the US, we're bringing in Lauren Adler, Associate Director of the USC Brookings Shaffer Initiative for Health Policy. Lauren, thank you so much for joining us. One of the things that we said a bit earlier is that we're in year one of the No Surprises Act. What do you think are some of the biggest hurdles getting doctors and patients to understand the protections of the No Surprises Act?
So some of the biggest challenges here are really just getting the word out. Doctors and hospitals have been doing business one way for a long period of time here. So, particularly for smaller doctors' practices across the countries, there's getting the word out, making sure everyone knows the protections, and also just clarifying a lot of the sort of edge cases involved in the law here. And hopefully we can get to a point where things sort of self-operate. Here, right, the law was structured so that hopefully patients don't really need to do anything here. This should really be all happening behind the scenes and leaving patients fully out of it.
I think one of the things that I'm kind of curious about here is, what happens if someone receives a surprise medical bill now at this point? What is it that they can do to address that surprise medical bill?
So if you, the patient, get a out-of-network bill, a balance bill from really any provider in an emergency, or the sort of anesthesiologist or radiologist, for planned medical care, you should not be receiving that bill. You should know that upfront. And then, your first recourse should be to go to your insurance company, make sure that things weren't being coded wrong, and make sure they can hopefully try to fix that. And they should be able to. There's a lot of regulations, and the law is quite clear that you, the patient, should not be getting that bill. But after that, your next step at that point should be going to either the federal government through the Centers for Medicare and Medicaid Studies, an agency in DC. They've set up a hotline you can call to try to resolve bills, and a lot of states have taken independent action to try to protect patients as well from these sorts of bills that accidentally slip through the cracks here.
We understand what the No Surprises Act is supposed to do, but what else can be done to improve our country's medical billing system?
So that's right. So surprise billing was addressing one part of the medical billing problem in this country, but certainly isn't a fix to the entire system here. So there's still going to be, patients are still saddled with very high cost sharing for plenty of hospital care. At that point, I think there's been a lot of work looking into some of the sort of the more aggressive billing practices more broadly from hospitals in terms of going after patients, trying to send bills to collections and that sort of thing. There's been some action recently trying to make it so that medical bills are much less likely to end up on the patient's credit report and hurt your credit score for, when you're trying to get a loan for a house or car or what have you. Those are sort of, I think, some of the things trying to get rid of some of those aggressive billing practices from hospitals are some of the next step. But, I think beyond that, you're really looking at bigger reforms to the system where you would be trying to just sort of reduce the amount that patients are being held responsible for, because that's really, that's really the core of where most of these problems come from, is just that healthcare is very expensive, and, through federal subsidies, we pay for a good amount of it up front. But not all of it. So that, folks can still be easily left with thousands of dollars of bills left to pay.
Yeah. Lauren Adler is the Associate Director of the USC Brookings Shaffer Initiative for Health Policy. Lauren, thank you so much for your time.
Thanks for having me.